Hello, my name is Dr. Tony Ioppolo. I'm the owner of Pinehurst Animal Hospital. Today, Finn, Samantha, and I are going to teach you how to give subcutaneous fluids or sub-Q fluids to a pet. This is a common thing that we may do to help give a pet fluids if they're dehydrated, but not bad enough to need an IV catheter and stay on fluids at the hospital. It's also a procedure we do where we'll have an owner take the fluids home and they'll use it on their pet, especially cats who may have more commonly be affected with chronic kidney disease. So let me go ahead and show you how to do this procedure. What you have for this is a bag of fluids, and you can raise it somehow, sometimes an IV pole. Obviously you won't have that at home, but anything to keep it elevated so gravity can help the fluids go in. You have an administration set and then a clean needle. You always want to use a clean needle for sterility. So to do this, we'll get Finn here. A good spot to place the fluids is going to be right back here between the shoulder blades. It tends to be less sensitive for them. So you uncap the needle, make a little pocket right here. And you can see how you make a little pocket and you want to give it under the skin. So you go ahead and you push it right there, you pop it in there. He says, oh, what was that? And then you go ahead and hold that in, and we go ahead and start the fluids so they can actually drip. Then the fluids are going in, and then depending on the size of the dog will determine how many fluids they get and also how dehydrated they are. In this size pet, we'll probably get between 100 to 150 mils of fluids. And if you're doing this at home for chronic kidney disease, it may be something you do a couple times a week just to help with fluid depletion. We won't show you the whole fluid time because it takes about 10 minutes to give all the fluids needed. So after you give the fluids, you monitor this spot, you want to make sure it's not getting too full. It will make like a little bubble underneath the skin. So after you've given all the fluids, you check the little numbers on the bag to make sure you gave the right amount. And then to stop the fluids, you go ahead and stop the fluids from running with the little dial here. And then you go ahead and just remove the needle, hold it off for just a second, give them a little scratch. And then you always want to recap, remove the needle, and place a new one on for sterility. You always want to use a new needle and to keep it very clean, because this could be something that's used repeatedly at home. So if you have any further questions on this, you can always look on our website at www.pinehurstvet.com, or you can check us out on our Facebook or Instagram page. Thank you very much.